Hey everyone, how you doing? My name's Gus, I'm a cosmetic and implant dentist. Today, let's look at having all-on-4 or having a full mouth rehab done in 2024. How have things changed? What's progressing? What am I doing differently this year compared to last year? Whoa. Okay, guys, let me just interrupt myself here because when I originally shot this video, it was supposed to be a relatively short video, but it turned out to be this 25-minute monster. And what we can actually do is split the video up into 3 sections. Okay, so there's 3 ways, 3 areas that we've improved our all-on-4, especially for 2024. Not specifically for the year, but it's just an ongoing improvement. First is the surgical process. Okay, arguably the most important part of this whole process. So what I mean by that is, how do we ensure we get our implants in exactly the right place? And that's what this video is about. If you skip to the part 2, that's going to be about how we make the final set of teeth and our process there. And part 3 is the different materials that we're using these days. Okay, so let's get back into the surgical side of this, and you can watch part 2 and part 3 on my channel as well. Now, in a number of videos, I've mentioned that the way we do any treatment doesn't just stay the same. Okay, we evolve it, we improve our systems wherever we can. And I think recently I've really embraced guided surgery. Okay, but you'll probably see videos on this channel from years and years ago telling you how great guided surgery was. Well, the truth is I've been using guided surgery for a long time, especially for single teeth or multiple teeth, where we've got other teeth. Now, let me explain quickly what guided surgery is. When we do any kind of implant treatment, we want that implant to be in an absolutely perfect position. Now, we could just make the hole by hand, by eye, just look at the other teeth and try and get our angles precise like that. And this is how dental implantology used to be carried out for the vast majority of cases. And even today, I'll still do it like this in certain situations where I've got no other option. But guided surgery is a way of pre-planning the position of where we want our implant to be. We'll take certain records before the appointment. We'll then plan the implant on a computer and we'll have something called a 3D guide made, okay, or a surgical guide made. It's 3D printed and it's designed to sit on top of the teeth. It's got a little hole in it, and this hole, we've got special drills which coincide to the diameter of this hole and the depth of the implant. So that means we can get the hole exactly right and the implant goes in exactly the right position. Okay, this is a fantastic development in implant dentistry. It reduces clinical stress massively and it ensures that our dental implant is as close to perfect every single time. Now, I will use guided surgery absolutely wherever I can, but until recently, it's kind of not been the thing in all-on-4 treatment when you're having the full set done. The reason is the guide has to sit on teeth, and during an all-on-4 procedure, we take out all of the teeth, we actually then reduce a little bit of the bone, and then we place all of our implants in that position. And I've been doing this freehand for the last God knows whenever I learnt to do this treatment, and it's a very successful way of doing treatment. You see, when you're doing an all-on-4 treatment, your implants have to be in a good place, but it's a little bit more forgiving. If your implant is slightly out of position, there's a lot that can be done to make sure that the final teeth are not compromised in any way. And the vast majority of surgeons who I know who do all-on-4 treatment will do it freehand. But in 2023, I got a piece of software and I thought, well, you know what? I really want to learn how to make this thing called a stackable guide. Okay, and a stackable guide is a whole series of guides which are used in a certain order so that we can pre-plan how much the bone is going to be removed. We can remove teeth on the software. We can then place our implants in this bone which has already been reduced. And we can make a set of temporaries which could perfectly fit that implant position, okay? And It, I tried it a couple of times and it really reduces clinical stress. Okay, you don't realize when you're in the moment and you're really focused. You know, you're looking at all your landmarks. Okay, because we don't want our implants to going in the sinus. We don't want to hit any nerves at the bottom. So you're looking out for all of these things and you're making this judgment on what the perfect angulation should be. But when we're doing this guided and all of our guides fit, then it reduces a lot of stress during treatment. And I've got that added confidence that the positioning of all of my implants is pretty much as perfect as it can be. It also reduces treatment time a little bit, okay, not massively, but a little bit. And I think it just improves comfort for our patients. And I know in advance if we're going to be needing to do any bone grafting or anything like that. So there's very little in terms of surprises. Now, there have been situations where I can't use a guide, okay? There was one lady who I saw who had a very small mouth and we physically weren't able to get these guides in position. So I had to go back to doing it freehand, okay? And still got a fantastic result doing it freehand. So my point is that all these cool technologies exist and there's an argument that the clinician doesn't need to be that experienced anymore. But sometimes these things fail. And in that situation, I would never want to let my patient go home with no teeth and no implants, okay? I think fundamental surgical skills is important. We have to learn to do these things freehand. We can liken this to sat-nav, right? I grew up in an age where I can remember my parents planning the route on a map and basically having a list of the roads that you need to get on and off at junctions, all that kind of stuff. And that's how people used to travel. Okay, these days we've got sat nav. It makes it a lot easier. But I think it's a good idea to know how to be able to read a map and navigate without a sat nav. Now, this process of making these stackable guides is very time consuming. To give you an idea, I think it takes me, when I do it myself, about an hour and a half per arch to do. Okay, so if we're doing a top and bottom case, about 3 hours in treatment planning. And if you follow me on Instagram quite often, on Friday I'll post a video of me behind a screen just showing you the case that I'm planning. Okay, typically on Fridays I'll spend a lot of the day just planning cases. Okay, we'll make these guides. I'll then send all the guides to a 3D printer and have them made ready for our surgery. It definitely does not reduce the overall treatment time by an hour and a half per arch. Really, economically, there's no advantage in doing this whole process of making these guides. So I made a decision a little while ago. If I'm going to provide this treatment for my patients, I just want to provide the absolute best care I can, okay? And I don't want to compromise just because something is cheaper. It's cheaper to do it freehand, and I can do it freehand. I know how to do it freehand. I've been doing it freehand for absolutely years, but I feel that incorporating a 3D guide is just a safer solution and a more predictable solution. Okay, there are less surprises from a clinical point of view. What it also lets me do is design the temporaries exactly how I want. Whenever we see a patient for a full mouth rebuild, quite often we've got no kind of reference points of what we want the teeth to look like, how long they should be, where our midline should be, all of that kind of stuff. So I'll do a facial analysis and I'm able to transfer that into the software and do all the design of the teeth myself. I could outsource this to a dental lab, but I just feel, because I'm the only person who's actually met the patient and you just get a separate feeling of where the teeth should be. I can translate that into the software myself. So this is one step that I don't outsource to a lab anymore. It also means that when we see our patient and we've got our diagnostic scans, our CT scans and our digital impressions, that the next appointment is to actually do the treatment. Okay, whereas historically we may have a couple of setup appointments where we try in different sets of teeth and record the bite in a certain way, but we're able to do this all in one step now. Okay guys, so I'm sorry if that's a bit of an abrupt ending, okay, because remember I wasn't planning to do all of these videos in 3 sections, it was one long video. But hopefully this gives you an insight about how we've really improved and embraced digital technology in order to help us get the surgery exactly right for our patients. In part 2 we're going to be talking about the teeth part. Okay, and this is often overlooked because traditionally having the teeth fitted on the all-on-4 appliance requires lots and lots of visits, and there's a bit of guesswork involved. So we want to reduce the number of visits and reduce the guesswork. So a lot of that will be all in part 2 of this video series. I'll see you then.